Welcome in this special edition on Défi Santé. Today we'll be interviewing Professor Wang from Singapore. We'll be talking about new vaccine, coronavirus, and potential outbreaks in the coming decades. Good morning, sir. You are a professor in the program in emerging infectious diseases at Duke-NUS Medical School, Singapore. You are a prominent contributor to scientific work on coronaviruses, including Covid-19, and your team is working with local and international partners to develop new vaccine and therapeutics for Covid-19. Can you provide us with an update on your work till now?
Yeah, so, we have several teams in our program. We're working on different aspects, as you say, from diagnostics to vaccine and therapeutics. And currently, our progress is the diagnostic kits is being commercialized as CPAS. And so we'll be using that for two main applications. One is to look at the efficacy of the vaccine, and the other is try to trace the origin of the virus. So that's the diagnostics. In the vaccine area, so we have another professor is collaborate with a commercial company on the Arcturus. So they are working a similar mRNA-based vaccine. So it's a very novel technology. The difference is that the Pfizer and the Moderna vaccines are just mRNA without replicating, and our mRNA is capable of replicating. So now we just finished phase 1 and 2. Hopefully, phase 3 will start very soon. And in the therapeutic area, we're also working on monoclonal antibodies. Yeah, so it's a lot of going on right now. Yeah.
Since the beginning of this week, UK is using a new vaccine. What are your views?
I think, because COVID-19 had such an impact on public health, so although vaccine is not the solution, but it's a very important part of the solution. So I think, this is something that internationally, especially the world leaders, have to make a decision, right? As scientists, we have done as good as we can. So we develop, internationally, basically have vaccines within, 10 months. That's unprecedented. And so I think the politician made a decision to use, and the UK now is the first one. But I think many nations will follow.
There are various vaccines being developed in different parts of the world. How reliable are they in terms of accessibility? Since you are currently involved with a number of WHO bodies, what is being done to make sure there is equitable access to those vaccines, that is remote countries not being left on the side of the road?
Yeah, so as you know, there's an international organization, COVAX, and organized by the WHO. So in terms of equal access, it's a dream, but not easy, right? Because it has, I think, the three aspects, right? The political will, the financial backing, and then the technological sort of hurdles. Because like the first two vaccines, the mRNA vaccine from Moderna or Pfizer, both require very low temperature storage and the transfer. So obviously, in certain developing nations, that will be a challenge. Whereas, in other places like the UK vaccine, the Russian, the Chinese vaccines, this will be involve some of the inactivated virus or, vector delivered vaccines. So this has a less stringent requirement, and hopefully will be cheaper as well. And I think maybe, out of all the difficulties, maybe the financial backing might be the easiest to overcome, because the international community really want to get this under control. So political will and also the technological hurdles are the ones that we have to focus on. Yeah.
Your team has invented the CPAS kit to detect if someone has antibodies which neutralize the virus. What is it about? How does it work? And what are your findings from using this kit?
Yeah, so first of all, for your audience, we have to educate them, when you get infection, whether by COVID-19 or by any other pathogens, whether it's a virus or bacteria, your body will produce hundreds, if not thousands, antibodies, and they will bind to different parts of the pathogen. and then some of them just binds there, others that bind to a critical part of the virus and then neutralize it, means the virus is no longer able to infect the human cells. We call this neutralizing antibodies. And we know for COVID-19, the virus has many, many proteins, and so only 1 to 3% of your body's antibodies will be neutralizing antibodies. So up until now, when you see many commercial antibody testing kits, they test either IgG, IgM, or IgA. So these are different isotypes of the antibodies, but functionally, they're all detecting binding antibodies. Whereas the CPAS is a totally novel idea. So what we invented a test kit which actually mimicked the virus and the human cell interaction. And so in the presence of the neutralizing antibody, that interaction is blocked. So we actually transfer this concept. Basically, it's a biochemical simulation of the live virus interaction with the live cell. And we developed a commercial kit. Now it's commercially available as CPAS. So what CPAS measures is neutralizing antibodies. In terms of how this will be different, I'll give you an example. So there are already published studies that, some individuals are positive using a binding antibody kit, but it's negative in our neutralizing antibody kit. And then these people happen to work in a fishing ship, and they go over the sea. And unfortunately, that they had a huge spread of the COVID-19 virus on the ship. And the person which have neutralizing antibodies are protected, don't get an infection, but the binding antibodies still get infection. So this is the best example to say why we need to determine neutralizing antibody, because it's a functional part of antibody response. So now with the vaccine, on the horizon, you have billions of people will get a vaccine, but not all individuals will react equally. Just like when you get a virus infection, the immune response is very different. Same with the vaccine. So even if it's 90% effective, you still have 10% people who are not maybe protected. And so we need to know their neutralizing antibody level, because the common sort of injection is 2 doses, but some people may need a full dose. And how do we know? We need to measure the neutralizing antibody. Okay, yeah. So this is just many applications, but I just list a few. Yeah.
Part of your work focuses on surface infection. What are your views on long-lasting antimicrobial coating that has been used extensively in Singapore?
Oh, I think that this is, a part of the overall package. I always say, if to fight and prevent infectious disease, you cannot rely on one single technology. So even with vaccine, we will know there still may be escapes. Some people are not protected, right? So then you can wear a mask, you can wash your hands, but then also with technology advancement, if we have this lasting sort of antimicrobial surface, applications. Of course, that's part of the equation. But again, no single technology will solve the problem. We have to really employ all of them, and also to educate our global citizens, to pay attention, basically. Yeah.
In Mauritius, our borders are closed since March, and the sanitary measures imposed seem to have been relatively efficient. From a scientific perspective, how would you explain this?
Oh, I think, before a vaccine is available, I think, containment, we call containment or quarantine or lockdown, looks like it's the most efficient measures. And then, of course, it's a balance of public health, disease versus economics, right? The economy. So I always say, it's if the short pain can result into a long-lasting gain, then I think the short pain, like in your country, if a 2-week lockdown is effective, then certainly it's a worthwhile, because before you have a vaccine, this is still the most effective way of containing outbreak. Yeah.
In the news, there have been recent cases of minks being infected by the virus in Europe. What could explain that the virus jumps from species?
Yeah, so this is another area of my research, is because most of this really highly lethal virus, whether it's SARS, whether it's MERS, whether it's COVID-19 or Ebola, unfortunately, they are not human virus. So in nature, they don't live inside human bodies. Instead, they live inside animal bodies, right? And mostly that they use bats as a reservoir. So they live inside bats, okay? So the chances for these animals to cross the species, jump from bats to human, is very low. So that's why otherwise, we would not survive. There's so many viruses bats carry. But once they get into human, then followed by human-to-human transmission. So we call this a zoonotic transmission, a forward zoonotic transmission from animal to human. Certain viruses, if you have lots of people infected like COVID-19, we now have more than 60 million people infected, then the virus will adapt and there's a chance to reverse zoonotic transmission. They spill back into the animal population like the minks, in Europe, USA. But also tigers, cats, and dogs are susceptible, right? Not as susceptible as being. So that is not unexpected, but certainly adds the complexity to disease containment, because once the virus jumps to the new host, they change, okay, to adapt to the new host. So if they jump to more hosts, they have more change, and that is going to be a further challenge for diagnosis and for vaccine.
You also warn about another coronavirus hitting humans within a decade. Can you tell us more?
Yeah, so in 2013, I made a prediction to say, there will be another killer virus from bats and can jump to humans. So in my profession, as scientists, if your prediction is proved to be true, you should be happy. But in my profession, if my prediction is true, that means people have to die. So that's kind of a double-edged sword. But still, scientifically, without being biased, I think we know that there's so many viruses as naturally occurring in bats and other animals, and also our farming practice, our international travels, our wildlife tradings, all these activities will increase the risk of this spillover for virus to jump from animal to human. So it's almost certain, unless the international community change our human behavior, then it's only a matter of time. You will have events like this, every few years, 10 years. But I have to say, even that, for scientists like myself, we could never predict the scale of the outbreak. We say it will be outbreaks, but not as big as COVID-19. So I think, for COVID-19, I have to say the international community, we did not do well. I think, if everybody did what your country did, then the world will be much safer today. Scientists like myself, we say we can do more surveillance, more early warnings, but I think equally important is that we have to try change our mind setting, because like when COVID-19 was starting in Wuhan, most people, even include the very civilized Western society, powerful, basically says, don't worry, it's Chinese problem. It will not come to us. Now, so we lose that very, very crucial early containment. If everybody, once the Wuhan city was shut down, if everybody is to say, let's, follow the lead and let's synchronize. If the whole world shut down like your country did at the same time for 2 to 4 weeks, we would have contained everything, right? So before COVID-19, everybody would say that's impossible. I mean, even the Western media said that's a violation of human rights, right? You cannot shut people down. Now, 10 months later, if we can go back to January, I'm sure every nation said we will shut down for 1 month. Whatever economic loss will be paid back by control the disease first. So that's a big lesson, but to me, it's not a scientific lesson, it's a political lesson.
In the short and medium term, how are things going to evolve around the world with this new virus?
First, I think, with the nations still have, like USA, Europe, I think, the quarantine, the lockdowns, the social distancing, and the contact tracing should still be the front line approach. Because even like UK started vaccine, 2 days ago, but it's only a minority, less than 10%, 5% of population. even if you can vaccinate the whole population, or at least 80% of the population by the end of the year, I don't think that's possible. Most likely, will be the second quarter of next year. So in the next few months, especially, winters are coming to most of the nations, I would think that we should not drop the guard. We should increase our alertness and increase our measures of containment, because vaccine will not save us in the next few months. So if anything, we should tighten and heighten our measures, okay? Then by second or third, middle of next year, hopefully a large proportion of the world population, I'm not talking about just the UK and the USA, it has to be world population. Nobody is safe unless everybody is safe, okay? This is the infectious disease, and we have to learn the lesson of January. We think it was a Chinese problem, and then eventually spread, right? So in the next few months, as I said, number one is that, heighten the measures of containment. And then number two is mass vaccination, as many people as possible around the world rather than just in few countries. And then middle of next year, scientists like myself, WHO, will have a much better handle on the efficiency of the vaccine. So if by then we think, the herd immunity, you heard a lot about herd immunity. Herd immunity is we need to have at least 60 to 70% of the world population is protected, means they will not be able to infect or transmit. And then we can talk about, open up the borders and, go back to the travel and things like that. Yeah.
Thank you again, Professor Wang, for your time.
Thank you. Yeah, bye-bye.